Welcome to YINZ Podcast. I'm your host, Envy. The other thing about the Down syndrome is I heard the national funding for autism or other special needs is much higher than Down syndrome. Even the government or the government in the top level do not have the awareness that other special conditions have. So they have less or even not any offer from the national government. So, do you think that needs to be improved or some kind of awareness there also?
Yeah, so that's a really great point. I would say absolutely. And there actually has been some growth in that area recently. So, in the last 5 years, there has been new funding that's come through the NIH, the National Institute of Health, specifically to focus on research around the care of people with Down syndrome. $21 million. 21
Mm.
because of obviously Down syndrome and trisomy 21. And that was because of advocacy. Families and self advocates going to Congress and saying, we're important too. But really important story. Once again, when we care appropriately for those with Down syndrome, we actually care for all of us.
Mm.
Um, why is research within the Down syndrome community important? How does it actually impact all of us? Well, obviously, when we care for those within the community, it helps them live more fuller and thriving lives, and they get a chance to really impact us. But also, one of the things that is a challenge in Down syndrome, we know that Alzheimer's disease is very common as those with Down syndrome age. Starting at age 40, and as they age, the proportion of individuals with Down syndrome who develop Alzheimer's is very significant. When we actually think about how do we diagnose and then how do we treat Alzheimer's within this group, we will actually develop the keys to how do we treat Alzheimer's in a global community. And so I think once again, it's a value that when we care for certain people well, it actually trickles down and impacts everybody. So I think it is important for us to think about how do we fund the care of all people.
It's a win situation for advocates and Down syndrome group. So, what other question is what is the main cause for the Down syndrome in first place, especially in the U.S. population or anywhere else? Even though it's like a genetic uh, information change, but what is the root cause? Like, do you have any root cause, if any?
Yeah, that's a great question. So while Down syndrome is a genetic disorder, meaning that it's based on a difference in our genes, meaning that we have an extra 21st chromosome, most of the time, so greater than 95% of the time, it's not necessarily something that is, you know, genetically transmitted from mom and dad in the traditional sense. Meaning that when you have one child with Down syndrome, the chances of you having another child with Down syndrome doesn't go dramatically up. It's not that one parent carries the gene and so that there's a high level of risk every single time. Often what happens is that when our genes are splitting, what typically happens is our cells have 46 chromosomes, and when we're making new cells, those chromosomes split. And when we make sex cells, actually we have the chromosomes split into halves. Sometimes that 21st chromosome hangs on so that usually it's within the egg. That extra 21st chromosome, just by accident, that egg has an extra 21st chromosome. And so when mom and dad's cells come together to make a new person, there's an extra 21st
Mm.
chromosome. And that is a random event. We know that as people age, meaning the older maternal age you have, the chance of having a child with Down syndrome goes up. That's just because the chance of that error occurring is higher in that age group. Once again, it has nothing to do with what anybody did or any kind of exposure. It's a random event. And so we don't think of it as something that people should worry about that they did something or they had an exposure that led to their child having Down syndrome. It is a unique aspect of who they are that occurs just as the genes are splitting. There is that small group of people, like I said, less than 5%, which have truly what we think of as a genetically motivated form of Down syndrome, something we call a translocation. It's where a parent has one of their chromosomes that actually, instead of being just one chromosome, have two chromosomes stuck together.
Okay.
And that parent carries that in all of their genes. And every time they have a child, there's a higher risk that that child will have that extra 21st chromosome.
Okay. So you're saying like there is no male or female relation to Down syndrome. Like it's only when women of certain age, the chances are more, but there is no specific.
Yeah. And just to also be clear, like while there is increased probability that you'll have a child with Down syndrome, the older you are, um, that doesn't mean that younger people can't have Down syndrome. That
So, like, is there any age mark like that like tells us like okay beyond this age probably the probability increase 50%, 100% or something like that?
Yeah, so it's not that high.
Okay.
So we always think that, what you'll notice is that when you're meeting your OBGYN, if you're a woman who's over the age of 35, they may recommend some extra testing to be able to see if your child has Down syndrome. That's just because that's kind of one of the transition points where that possibility goes up. But like I said, I will say that actually more families that are younger have children with Down syndrome than families that are older. And the reason why is that younger people are having more children. And so even though their probability is lower, there's more families out there that are younger that have children with Down syndrome. So once again, I would say it doesn't mean you should be afraid. If you're older and you have a child or you're pregnant, I think it's just good to get all the information you need to be able to make a decision as a family what to do.
Okay. So compared to 25 years or 30 years back, we're getting a better quality of care and also the life expectancy in Down syndrome increased tremendously.
Mm-hmm.
Uh, what are the other significant changes over the past decade?
Yeah, that's a really great question. And I would say it's not all healthcare. I think there have been some amazing healthcare changes in that time period that have been really important. So some of the things we can do to treat some of the devastating healthcare problems. So kids who were born with really severe heart disease that may not have been correctable before are correctable now. Some of the kids who were born with digestive problems that may not have been corrected before are corrected now. And that's a huge impactor. But I actually think probably one of the most significant impactors are the way in which we as a society have decided that individuals with Down syndrome, where they should be, where they should live, where they should grow, is with their family and in their community. Historically, if you look at the 80s and before, 1980s and before, often many people with Down syndrome were institutionalized, meaning they were taken out of their homes and they were placed in large institutions and cared for. And that form of care often impacted their health and led to early death. What we can recognize now is that when we give individuals with Down syndrome the right support, be within their family, getting the support they need educationally, addressing their needs as they develop, they often thrive and excel. You're talking about in the 80s, a life expectancy in the 20s, and now a life expectancy, that's a mere 40 years later, is now a life expectancy in the 60s is a dramatic change. And I actually think it's a lot of those community interventions that have been super big impactors and important impactors in the lifespan and the thriving of people with Down syndrome.
Okay. So the real inclusion actually made a difference here.
Yeah.
So what are the some typical concerns parents express after initial diagnosis, either during pregnancy or after giving birth? We talked about this one, but I'm specifically wanted to ask because
Yeah.
yeah, like what kind of questions and what
Yeah.
goes into their mind? And
Yeah, so I would say some of the initial concerns that families have right after receiving a diagnosis of Down syndrome or right after birth is number one, is my baby healthy? That's all of us, right? When anybody holds their child for the first time, the thing they're going to think about is my child healthy? And one of our first goals is to recognize if there are any health challenges that we need as a healthcare community to come around them and support them. That's why when kids are first born, they get an echocardiogram to make sure their heart is safe. We do blood work to make sure that their body is functioning normally. And then we often do hearing tests and vision tests just to make sure everything is going well. And then we support any challenges that are there. The other question that families will often ask me, just like any other family would ask, is what will their future look like? And that's usually what I tell them is this is going to be our journey together. As we get to know each other, my goal is to work with you as a family to recognize any challenges that will arise, and so that we can support you, but also recognize those strengths that our young adults have and our kids have so that we can help them be the best person they can be. I would say one other thing that I will just highlight that's a really important point is that there's something called early intervention. Early intervention is a state funded program that supports our kids in their development. And it starts right at birth all the way to 3 years of age. So while we as a healthcare community are supporting any challenges in their physical body, we also want to think about how are they developing, how are they learning those skills, and it's really important. And we work to connect our families with early intervention so that they can have occupational therapists and physical therapists and speech therapists to support their kids in that first 3 years to develop all the skills that they need.
yeah, that brings our next question. What are the different stages of developmental progress compared to those who do not have this condition?
That's a really great question, and families will ask this all the time. And it's interesting. As pediatricians, you walk to your pediatrician's office, and they're asking you about, oh, are you sitting? Are you walking? Are you crawling? Are you feeding yourself? What kind of grasp are you using? Oh, how many words are you using? All these things, right? They're thinking about what are the different gross motor, fine motor, and speech skills that kids are developing. In what we define as normal, right, is this idea that actually everybody has a different developmental trajectory. Everybody has a little bit of different way in which they are getting to that target. So some kids are walking at 9 months. Some kids are taking their first steps at a year of age. Some kids are taking their first steps at 15 months, right? And what we do is we average those and we say people should be walking at a year of age. So just to highlight, what we define as normal is truly just a bell curve, that it's an average. And what I will tell families is that individuals with Down syndrome, that bell curve is just wider. And so we're going to be looking at the same skills. We want our kids to develop the same skills. It just happens at a different time frame. And I also think it's really, really important not to necessarily compare your child with Down syndrome with another child with Down syndrome, because there can be some variation. In general, most of our kids develop most of their gross motor, fine motor, and speech skills a little bit later. So, for instance, it is not uncommon that if you look at a typical gross motor skill, walking, that our kids may not necessarily develop that skill till
Mm.
2.5, and sometimes 3 years of age. And that's why, as I was talking about before, it's really important for them to get early intervention, getting early exposure with physical therapy to have that extra support to work and develop that skill. But what I would say is that while they develop those skills a little later, we still want to support them to get there. And so I often say, my job is to look and work with you as a family, identify those areas that are the most challenge for you. It may be walking, it may be learning to talk and getting the right supports around you. And we need to individualize that to each of our kids. And so not trying to put a hat on it and make a one size fits all, that your kid needs to do this at this age, but rather say, where are you at right now? And how do we get you to that next step? I hope that's answers your questions helpful.
Yeah, one more question to add
Yeah.
that one. So this is like speech generally,
Mm.
like I don't talk more details, in-depth details of the speech, but like the common question, like what is the age the Down syndrome kids can actually say three words combination or four words combination, so that at least they can do like the basic communication.
Yeah. So once again, I would say that when we look at all of the developmental skills, as a generalization, speech and communication is the area that is the largest challenge for our folks. Part of that has to do with what we call kind of the hypotonia. We haven't talked about this already, but there is just a difference in the strength and coordination of muscle groups. And if you think about it, verbal communication is a very complex muscular movement. When you make, vocalizations, your tongue is moving in all different directions, your mouth is making different movements. It's pretty complex. And so it is much easier to be able to crawl, stand, and walk than say a slew of different words. Um, so, what I often tell folks is we need to individualize it based on the skills of your kids. So, and a great example, just to give some generalizations, most people would recognize that kids get their first words at usually around a year of age. Mama, dada. I see that around 2 years of age is more common for our kids to have some first words. But that's a generalization. There are tons of our kids that those words are happening later. And so we really have to say, where is your child at in developing those unique skills? The other thing that I will highlight um, as I take care of a lot of adults is that it is not uncommon that some of our young adults still have challenges with communication. I will highlight that doesn't mean that they don't understand things. So we think about language in two ways. One is receptive language, meaning do I understand the language that is coming in, and then expressive language. Am I able to say what I think from my head? And often the problem with expressive language, getting our words out, is not that they don't know what they want to say, but once again, their muscles aren't listening and there is some difficulty in articulation, their ability to communicate clearly. And so it's really important sometimes as adults to work with someone to learn the skills to help them best communicate. A great example, if I'm meeting a young adult with Down syndrome for the first time, they are often very excited to tell me a lot of information. And so it's not uncommon that they will speak really quickly and try to get their words out. And when they speak really quickly and try to get the words out, it becomes a little bit jumbled. I think as a society, what we should recognize is that doesn't mean that young adult can't communicate. What we need to do is just support them. And so often what I'll say is, oh, I'm sorry, I didn't understand. Would you be able to repeat that for me again a little bit slower? And often that helps with some of that articulation. And what I encourage families to do is your young adult best, your child best, and be able to work with them on the skills to be able to say, what are the challenges in my communication? Is it that I, you know, have a hard time articulating, and so I need to work on pacing? Some of our kids have something called apraxia, and that's where there is a difference in their ability to be able to get the words that are in their brain out. And so sometimes they need to use assistive devices to be able to communicate, not fully, but part of it. And so thinking about what are the tools to help them communicate best. So I think we need to individualize that communication piece and say, hey, what is the best way we can support communication, either through development of skills and being able to learn and develop the strength and dexterity of those muscles of our mouth, or if we need some support using other assist devices, if it's possible, that can be a strength for them.
Yeah. So the assisted devices, I really like them because when we used not only the assisted devices that schools use, but also for our daughter, we used like a app called Gemini. So it actually tells kids like any spectrum, like even like a normal kids, like to speak words, like showing the mouth movement, lip movement, and
Mm-hmm.
everything like several times. And it's like it's not like what age you have to use what kind of lesson, but it's like just like how you told me, like it's a different spectrum, like you can choose your learning level. And it taught like a 200 words in like within uh, like a 2 years age for my daughter, like, so I recommended that to many people as well. So sometimes, yeah, look for things outside the
Yeah.
yeah.
And I think that's a really important point that you're making, because also that gets back to, once again, what are some of the learning strengths of individuals with Down syndrome? So, what I mean by that is, often when we think about learning speech, we think about it as, oh, I have to hear the speech and I have to hear the different tones, and then I'm going to be able to articulate it, right? Most kids, they're sitting there and they're just kind of getting everything um, and hearing everything, and then they're learning to speak. But our young adults our little kids are visual learners. So I love that Gemini is showing them how they articulate with their mouth. It's visually giving them input on what speaking looks like, because that visual input is a strong tool for learning for our young adults and for our little kids. And so I love that that program feeds into that visual strength, not just the typical learning style of listening and speaking.
Also, like what do parents need to watch for, especially in a different stages, like at infants, a toddler, a teenager, adults in a Down syndrome population? Like, is there anything they have to keep an eye, so that okay, okay, at this age the doctors guide everything, but like if mentally preparing a parents
Mm-hmm.
would, like they don't have like any surprises.
Yeah. I think that there are kind of some big, broad strokes that, as you, like any of us, as we go through different stages of our life, different things become more important kind of parts that we need to focus on. So often, when we kind of highlighted this earlier, that when you're really young in that first year or two of life, the focus is often on healthcare. Like, are there any health challenges, and how do we as a healthcare community come around and be able to support a congenital heart disease, or a digestive disorder, or a hearing difference, or a visual difference? But then as kids get older, so we're getting into that toddler age and that preschool age. And what we notice at that time is that we're really seeing that development is really important. That's where kids are learning all the skills they have for walking and running and playing and speaking. And then how do we integrate into a classroom, and how do we learn? And so we're focusing really on those development skills. And then as they get older, and we're now moving into middle school and high school, we see that just like any other kid, um, socialization is super important in developing relationships with peers. And so sometimes we start seeing behavioral challenges that arise. Just like any other teenager, they're developing their own identity. And in that, there can be different struggles. Sometimes there can be anxiety or depression or other challenges that arise. And then as we move into adulthood, just like anybody who is aging, some of those health concerns come back up. But some of those health concerns are now different than we think about little kids. Like I said, we start thinking about the idea of Alzheimer's, which is often on the minds of what happens when people age. One important point I will make, though, is that Alzheimer's, while it does happen at a younger age in those with Down syndrome, it's happening in the 40s, 50s, and 60s. It's not happening in the 20s and 30s. One of the things that you will often recognize and you think about when you have a young adult with Down syndrome is that one of their strengths is something called the groove, meaning um, as they're walking through life, the thing that gives them the best uh, ability to function and thrive is often they like order and structure. They like to have um, the the right pattern for their life. They, want to be integrated in a workplace. They want to know what their expected day looks like. And when they have that order and structure, the groove, they really function well. But when they get knocked out of the groove, we often see loss of skills. And sometimes that can be a change in their memory. It can be a change in their behavior. And often what knocks them out of their groove can be a healthcare problem. So it could be sleep apnea, or it could be a new diagnosis of hypothyroidism. So if we see big changes in adults in their 20s and 30s, we shouldn't automatically jump to that this is Alzheimer's. What we should say is, what has changed in their life? Is there a medical need that we need to address? If we treat those things, often that helps that young adult jump right back in. So one of the biggest fears as people age is Alzheimer's, but we also have to recognize that still happens later in life. And when we have a change early in life, in their 20s and 30s, maybe we need to do a better assessment of what healthcare things could be around them. The other things that are really, really important in that young adult life is really making sure that we have focused on supporting their community and their socialization. The reason why I highlight that, and this is where it's really important to me as a teen doctor, as an adolescent doctor, if you think about it, 21 years of age is a huge change for a lot of our folks. Often they're in school from 3 years of age to 21 years of age. So often they will continue in their high school even after their senior year, after 18 years of age, and stay there till 21 years of age. But what happens after 21 years of age is often a challenge. We know that those with intellectual differences, 80% of people graduate to the couch, meaning that after they get out of post-secondary school, they often graduate to unemployment. They now are at home, and all of their social structure, all of their friends, all of their structure of their day disappears. And so it's really, really, really important for us as we're supporting young adults that we're supporting them in making that jump from ending their educational career into giving them into some form of meaningful support and employment. And employment doesn't have to mean a 9-to-5 job.
Some
It
kind
can
of
be,
inclusion.
yeah, it can be inclusion. It can be volunteering. It can be work on a regular basis that may only be a few days a week, but it's giving them that social structure that's really, really important for them.
All resources and contact information you can find in our description of this video.